This is your pelvic clock somatic lesson, and it's one of my favorites because it helps us to relearn some movements and some sensations and some experiences in areas of our body which are currently painful. It's a very supported, lovely lesson, and I'm going to teach you that this lesson is more than just the movements, it's also the attitude with which you approach them. So you're going to be doing this lesson laying down. Many of my clients prefer to lay down in their bed when they do this exercise, especially at the beginning when things are a little more sensitive. But if you prefer, you can lay down on the floor, on a yoga mat. I do prefer that you have something very low profile to cushion your head. So if you're in your bed, it's going to be a very thin pillow. If you're on the floor, it's going to be a nice thin blanket. The worst thing we could do would be to have the head really elevated or falling backward. We need the neck to be in a neutral curvature for this exercise. So let's get started. I'm going to have you lay down on your back with your feet flat on the floor and have your feet just about hips width distance apart with the heels roughly under your knees. This doesn't need to be perfect by any means. Let your arms just find a calm, soft resting position. As the arms move around, just make sure to check in with them that we're not gripping or clenching in any way. We'll keep the hands and the wrists soft throughout our exercise today. And once you've found yourself in a nice, comfortable position, I'll have you close your eyes and begin to lengthen your inhales and exhales. And as the breath is stretching out a little bit, notice the place where your pelvis is touching the floor. We would call that maybe the sacrum. And then notice the places where your body rises away from the floor at the pelvis. For example, how your butt and your thighs move away from the floor, your hips, and also your back. So is your lumbar pressed down? Or is there a nice soft curve there? And as you lengthen out your inhales and your exhales, start to notice if maybe the relationship between the pelvis and the places where the pelvis moves away from the floor are changing at all, or if they stay exactly the same. And if what you find is that nothing changes at all, it's okay. Or if you notice a lot changes, that's okay too. It may be that what you notice is that there's no movement, but perhaps some sensations in the back of the pelvis. Maybe it feels lighter or heavier during the breath cycle. And I'd like for you to please imagine that your pelvis is resting on the face of a clock, as if someone has drawn that clock face onto your mat or onto your bed. And the clock face is oriented so that the 12 is downward toward your tail, and the 6 is upward toward your low back. That would put the 3 on the right and the 9 on the left. So see if you can visualize that. 12 towards your tailbone, 6 towards your lumbar, 3 to the right, 9 to the left. And the next time you breathe in, let's experiment with finding the 12. So as you breathe in, go ahead and rock your pelvis so that it is anteriorly tilted. What that means is your tailbone is reaching down for the floor and your lumbar is gapping away from the floor. That would be the 12. And then let's find the 6. So do the opposite. You're going to push your lumbar toward the mat. Your tail is going to roll up slightly. And then come back to the 12 on the inhale. And back to the 6. So if you're watching the video here, you may notice that my movements are bigger than yours, or maybe they're smaller than yours. And I want you to know that I have hereby deputized you to do exactly the amount of movement that is perfect for you today. Typically, when I demonstrate, I'm going to exaggerate so you can see, okay? That doesn't mean that you need to match what I'm doing. If I'm honest, I'm probably not as comfortable as I could be with the exaggeration. I'd prefer something a little softer. So feel free to do whatever feels right to you, maybe even something that feels nice. Yeah? Moving between the 6 and the 12, please. With nice, soft, stretched out breath. Nice and smooth even. Let's do one more. One more 12, one more 6. And then come to a position which is resting. Imagine that now your pelvis is heaviest in the center of the clock. So the place from which the hands emerge. And in the center of the pelvis, you may notice that your lumbar is still curved away from the floor a little bit. In other words, it's not pushing down. That may feel a little unnatural to you. So if you're more comfortable, you feel safer having your lumbar pushed down, that's okay. But note that that would be more on the 6. So if you prefer to stay on the 6, you're welcome to. Just note that neutral is with a soft curve in your lumbar, okay? Neutral doesn't necessarily mean better. Now let's work horizontally. Let's go to the 3. So tilt your pelvis to the right. Let your thighs go with. Let the thighs tilt. And then come back to the center and tilt over to the left. Now, I wanted to point out the difference between neutral and kind of sticking to the 6. Because now that you're rocking side to side, you probably will not have as much comfort and ease if your lumbar is pushing down. Okay, so now would be a good time to experiment with finding something more neutral, thinking about the center of the clock and just moving horizontally side to side on it. Let's do one more to the right, one more to the left. We're just kind of getting the lay of the land here. And then the next time you come to the middle, just rest. Notice your pelvis. Notice if you naturally kind of pull back to the 6, or if you're more comfortable neutral, or maybe you're somebody who kind of naturally rolls to the 12 when resting, although that would be a little bit less common. Find again that nice, soft, easeful breath. Now this time I'd like for you to please keep your thighs vertical. So it's almost as if your feet are standing in concrete. So your thighs can't shift side to side. But your hips, they can rock to the 3 and to the center and to the 9. Think about that. Can your thighs remain vertical, fixed as if standing in concrete, but your pelvis rocks side to side? This is just a little bit of extra challenge to get all of your neurons perked up. And by the way, it's kind of hard. However, what we find is that we learn best when we're presented with at least a little bit of challenge. So that's why this is here. Now, the next time you rock to the 9, you can take the feet out of that concrete. Let your thighs tilt to the left. So go left with the pelvis, go left with the thighs, and then come up to the center. Let the pelvis tilt right. Let the thighs tilt right. I call this the windshield wiper, and it's one of my favorite things on earth to do. I love it. However, you may notice right away that it feels a little different on the left than the right, right? That maybe on one side it's a little tighter, maybe you just feel a little stuck, maybe it just feels more difficult, right? And I'd like for you to know, this is important, that the two sides of your body have lived two entirely separate existences for the duration of your current lifespan, right? Even though they're in the same body, they have very different purposes. They have very different roles in your movement. So it's okay if it's different side to side. In fact, it's normal. You would be pretty bizarre if you were the same side to side. I hate to tell you. You would be pretty weird. Okay, so come back to the center and notice. If it's okay for you now, you might like to send your legs out long, but many people prefer to have their feet flat throughout. Notice the right and the left. Now you'll bring your 2 feet flat again. And we're going to come back to up and down on the clock. So we're going to go to 12, and then we're going to rock to 6. Now, if you're somebody who likes to have your lumbar press down, I would bet good money that right now, when you go to 12 and your lumbar is arched, it feels a little scary. So your job right now is to keep your breath calm. Keep your breath calm. And notice if, when you get to that movement, which is a little more unfamiliar, if you tighten up at all, if you get kind of tense. Now, if you notice that tension, acknowledge it, because it's a very important protection mechanism that your body is doing unconsciously. However, sometimes our bodies do things unconsciously that are not in our best interest. So it's possible that by finding a nice soft breath, you could reduce some of that tension. Okay. The next time you're on the 6, so your tail is just a little lifted, your lumbar pushed down. I'd like for you to start to work the right side lower quadrant of the clock. So we're going to go from 6 clockwise to 5, 4, and 3. 3 feels really far away, doesn't it? Come to the center. Let's go to 6, 5, and maybe you're going to kind of click each number. 4, you're going to find it. 3, let's do one more like that, okay? Where you sort of segment. You break down the quarter of the clock into the segments between the numbers. 5, 4, 3. It's almost like you're rolling the back of your pelvis on the edges of the clock, right? And come back to the center. Now this time, I'm going to ask you to please let go of any need to do this correctly. Instead, just kind of slosh, slosh from 6 to 3 and back to the center. Even if you don't hit it perfectly, keep going. Do exactly this a few more times, because I want to tell you something very important, which is that you literally cannot do this correctly. I hate to tell you this. No matter how great you do it, it will not be right. But the same is true for doing it wrong. No matter what, you cannot do it wrong. So instead, let's find curiosity. Let's go 6 and find a nice, smooth, sort of slushy movement over to the 3 with lots of curiosity. One more to the center. One more to 6. Slosh it over to 3 and back to the middle to rest. Notice the right and left side of your pelvis. Maybe the right side feels bigger, higher, puffier, or maybe it just feels Zzz, like it's more active. Now let's come back to the 6. And then we'll go now counterclockwise. 7, 8, 9. And then back to the center. I'm going to give you 2 more to work the ittiest bittiest little segments of the clock. Okay, 6, 7, just so you can kind of locate them in your mind's eye. 9, and center. And I hope you're going about the pace that I am, okay? One of the things I see with a lot of newer students is that they really go fast because they think it's about the movement, not about the experience, okay? So we need to sort of transform our thinking. This is about the experience, which is best had if we move slowly. Now this time you're going to go 6 and then kind of slosh it over to the 9. Yeah. So it's smooth, it's messy. You're not going to do everything perfect, but that's okay because it's impossible. It's impossible to do it perfectly. 6 and slosh to the left, just that quarter of the clock to 9, just clockwise. Let's do 2 more. And again, you may find that one side is harder, one side is easier. If you are discovering that, then you are normal. You are normal. Okay, that's the last one. We're going to rest. So some people like to rest by stepping their feet out wide and letting their knees fall together. For some, that's incredibly uncomfortable. So you'll maybe just stay with your feet flat. And others feel good having their legs out long. Take a nice, soft, stretched out breath. Okay, so now we're going to have feet flat again. I'm going to have you go to the 3. That's to the right, okay? And then from the 3, we're going to go counterclockwise 2, 1, and 12. Ooh, that's an interesting movement, right? Come back to the center. We're just going to work this upper quadrant from 3 to 12 counterclockwise. 3, 2, 1, 12. Now here's where you make some decisions. The first decision that you might want to make is, how big is my clock? Is it a huge clock, like a wall clock, or is it tiny like the face of a watch, or is it something in between? This movement tends to be sensitive. Okay, so if you're finding that this one is sensitive for you, I suggest a very, very small clock. Okay, tiny, tiny, tiny clock. And if you're still feeling a little bit unsure, then maybe the best thing for you today is to imagine the movement. Imagine it rather than actually doing it for today. Since this is about your nervous system, that works just as good as doing it. Believe it or not, there's actually research on this. Let's do one more. We're just going to slosh it. Just slosh it. Don't worry about getting those numbers perfect. And rest. This is a shorter rest where you observe the right and the left. Now that's tilt to the 9. You're going to tilt left. Remember, your clock might be very, very small. Okay. And then we're going to go clockwise. 9, 10, 11, 12. Maybe you're still feeling like you just need to sort of get the lay of the land. So you're going to just work the tiny segments one at a time, kind of like you're clicking, right? Like the second hand or something. Or maybe you're just going to slosh. It's up to you. It's 100% up to you. But remember, the most important thing here is that you're really enjoying yourself. So if you'd be having more fun if you sloshed, then slosh. Find a nice stretched out, calm breath to support this. Let's do a couple more. Remember, you can't do it right, so stop trying. Just have an experience of your back, your pelvis, your waist. Notice your feet pressing. And then rest. This is a longer rest. Once again, observing right and left. Feet flat. So usually when I teach this in person, I like to do each quadrant of the clock with my client. However, I'm hoping that this is going to be a little bit more efficient for you so that you can really just use this video to learn this exercise, and then you'll do it on your own. And then you can break it into quadrants or halves or the full clock as you see fit with the amount of time that you have to practice. So I'm going to skip ahead a little bit. I'm going to have you go to the 12 now. Go to the 12. And then we're going to go clockwise. 1, 2, 3. Remember, your clock is pretty small. 4, 5, 6. And then come back to the middle, the place from which the hands emerge. 12. 1, 2. Your clock is little. 4, 5, 6. Keep going. Do a few more. Try to relax and reduce the tension in your neck, because you'll probably find that the back of your head is sort of mimicking the back of your pelvis in a way. That would be a good sign, because what that means is that you have eased the tension along your spinal column so that the curves of your spine, the natural curves of your spine, are moving in their natural rhythm and harmony. Let's do one more. Just a brief rest. Notice the right and left. Let's go 12. Now we're going to go counterclockwise. 11, 10, 9, 8, 7, 6, center. Take your time. 12. See if you can reduce that excess unnecessary tension along the spinal column. And if you are able to manage that, what you'll find is that your chin is going to kind of tuck down. It's going to tilt over a little bit to the left. As you get to the 6, your chin may lift a little. And you're not even doing that artificially. That's just the natural harmony of the curves of the spine. The lumbar curve and the curve in the back of your neck actually work together. They have their own sort of special dance that they do. Let's just do one more of this side of the clock. And remember, your clock could be any size, but if you're just starting out, it should probably be smaller. We like the smaller clock size because it builds capacity. It perks up the brain, those neurons. They're like, wait a minute, this is hard. What do we need to do to make this happen? Now rest. Let's take a longer rest here. So find a comfortable position. Okay, let's come back to feet flat. And again, recognize that I'm going a little quickly here because I want to make this lesson efficient for you to fit in. But if you need more time, once you've learned the basic movements, You don't even need to turn this video on. You just kind of roll around. You could roll around for 5 minutes, 50 seconds, 50 minutes. Okay. So let's start by coming all the way to the 6. So we're going to come to that pressing the spine down position, which I've noticed for a lot of my back pain people, this seems to be the default. And then we're going to go counterclockwise. 6, 5, 4, 3. Remember, your clock face is pretty small right now. 2, 1, 12, 11, 10, 9, 7, 6. Rest. One more breath on this next exhale. It's like you're going to feel all the tension along your spinal column just melt. Go to 6. And as you do your little circle with your pelvis, see if you can keep the tension as low as possible so that you're feeling the whole spine respond. This is the whole experience. Keep going this time. Do another circle. You got it. Next time you get to the 6, you rest. Six. Now let's go clockwise. 7, 8, 9, 10, 12, 1. Try to go at my pace or slower. 5 and 6. Rest. 2 breaths here. And this next exhale, the tension along the spinal column, even if it's the easiest little bit or if it's so much, try to let it go. Just let it melt into the mat or into the bed. 6, 7, 8, 9. Keep the breath so soft, so calm. Keep the neck calm. That's a good way to keep the lumbar calm, right? Remember, the lumbar and the neck have their own special relationship. So if we can reduce any tension or holding in one, we might have success reducing tension or holding in the other. Let's do one more circle. After that last one, you're going to rest. This is the last time you're going to rest. So if you haven't had your legs out long yet, maybe now's the time to give it a shot. If you can't have your legs out long comfortably, put something under your thighs. Put a pillow or, blankets or whatever. Put that under your thighs so that you can rest and breathe your spine. Very well done. And getting your practice in for today. I'll see you next time.